Welcome to The Explainer. I'm absolutely thrilled you're here with us today. We usually think of the human body as just a subject in biology, right? But today, we're going to look at it totally differently. We're treating the body as an entirely uncharted territory. Think of anatomy not just as science, but as biological cartography. We are literally making a map of what makes this tick. Okay, let's just dive right in. So picture this. You go to the doctor and say, hey, my stomach hurts. How in the world do they know what's actually going wrong inside of you? Because let's face it, the human body is a massive, incredibly complex landscape. To pinpoint a specific issue without getting completely lost in the woods, medical professionals have to know exactly how to read the map. Here is how we're going to navigate this together today. First, we'll map out gross anatomy, then we'll compare systemic versus regional approaches. After that, we'll look at the clinical advantage, go over some tools for navigating the body, and wrap up by packing the cavities. All right, let's start with mapping gross anatomy and setting up some boundaries. Whenever we study the body, we're essentially looking through one of two lenses. On one hand, you have microscopic anatomy. This is the cellular architecture, the super zoomed in cytology and histology stuff. But our map today, we're ignoring the microscope. We are focusing strictly on gross anatomy. That's the macroscopic world. The organs, the bones, the big structures visible to the naked eye. We're surveying the major land masses, so to speak. Now, within that macroscopic world, we actually have two very different ways to draw our map, systemic versus regional. So anatomists basically have two fundamental approaches here. Systemic anatomy tracks functional systems. It's like following a single highway across the entire country, tracing the whole muscular system from your head down to your toes. And that's fantastic for understanding physiology. But regional anatomy, that's completely different. That's studying the whole neighborhood. It's a hyper-localized view of gross anatomy where you examine how muscles, nerves, blood vessels, and organs are all tightly packed together in one confined space, like your abdomen. So which map is actually better for the real world? Well, let's talk about the clinical advantage. Consider this, Gray's Anatomy. Yeah, the book, probably the most famous medical textbook in human history. They literally completely reorganized their entire structure. They've ripped it up and went from a systemic layout to a regional one. I mean, that is a massive shift. It's basically narrative proof that regional anatomy reigns supreme in modern medicine. But why the change? Well, the text itself actually spells it out perfectly. They say that regional anatomy is widely used in modern teaching because it's just much easier to apply to a clinical setting. Think about it for a second. Patients don't walk into a clinic with a disjointed systemic issue. They don't say, my nervous system is acting up. They present with regional pain. My shoulder hurts, right? And to treat that, a doctor has to have a 3D understanding of that specific geographic intersection, how the bone, the muscle, and the nerve all interact right there in that one spot. Okay, so if we're dealing with these complex neighborhoods, how do we navigate them without getting completely turned around? We need a compass. We need a true north. And in medicine, that is the anatomical position, standing perfectly upright, feet parallel, arms down at the sides with the palms facing forward. By standardizing this, we eliminate any guesswork. It doesn't matter if a patient is lying face down or flat on their back, the map's coordinates never, ever change. And from that true north, we get our clinical coordinates. These are snappy, paired directional terms. You've got superior versus inferior, so above and below, anterior versus posterior, front and back, medial, which is toward the midline, versus lateral, on the side, and for the arms and legs, we use proximal versus distal. It's this incredibly efficient, universal vocabulary. It guarantees that a surgeon in one room and a physical therapist in another are always reading the exact same map. Mapmakers also use anatomical planes. Imagine these as invisible, two-dimensional cross-sections used to visualize these deep regions. The sagittal plane slices things vertically into left and right, frontal divides the front from the back, and transverse cuts horizontally across the middle. And guys, these aren't just abstract textbook concepts. They are quite literally the foundation of how CT scans and MRIs work, allowing doctors to virtually slice right through those regional neighborhoods we were talking about earlier. So, now that we know how to navigate, let's explore how the body actually packs all this terrain away into cavities. How is the internal landscape actually compartmentalized? Well, the body secures its deepest, most vital regions into fluid-filled cavities. Think of them as two massive safety vaults. You have the dorsal cavity on the posterior side, the back, guarding the brain and spinal cord. And then you have the ventral cavity on the anterior side, the front, which houses the thoracic and abdominopelvic organs. Let's dive into that ventral cavity, because honestly, that is where most of our heavy physiological action happens. Up top, we find the thoracic cavity for the heart and lungs, sitting right above the abdominal pelvic cavity. And what's just absolutely fascinating to me is the biological engineering going on in here. These regions are lined with serous membranes that secrete a lubricating fluid. It's essentially the body's natural WD-40. It's the reason your lungs and your stomach can expand and slide against their neighbors all day long without causing any painful friction. Let's actually put this to the test and map the abdomen just like a real clinician would. To avoid getting confused by a mysterious ache, doctors basically draw a grid. Imagine a vertical line straight down from the sternum right through the belly button. Then cross that with a horizontal line at the exact same point. Boom. Instantly, you have 4 clinical quadrants. Patient has pain in the left upper quadrant, the doctor's immediately visualizing the stomach. Right lower quadrant, they're definitely checking that appendix. It is literal biological geography in action. So as you sit here listening to this explainer, I want to leave you with a quick thought experiment. What specific regional muscles, nerves, and cavities are you actively engaging right now at this exact moment just to hold your posture, watch this, and process my words? The map of the human body isn't just something printed in a textbook. You are living inside of it right this very second. Thank you so much for joining me today, and until next time, keep exploring.